Do we finally know what causes fibromyalgia? I'm Dr. A GP based in the UK, and a new study has come out of King's College Hospital in London that gives some quite interesting results. So currently the general consensus is that fibromyalgia we think originates in the brain. So this study is very fascinating because it shows that fibromyalgia is in fact likely a disease of the immune system. The basis of this is that it's thought that antibodies in patients with fibromyalgia are the cause of the increased pain sensitivity of the nerves. It's a very early study, and the study was done on mice, and patients with fibromyalgia had the antibodies extracted, and these antibodies were injected into the mice. These mice then very quickly developed sensitivities to pressure and cold. What's interesting, however, is that these mice recovered after a few weeks once the antibodies had been removed from their system. Now, why it's very interesting is because it opens up new treatments for fibromyalgia which aren't currently offered. Therapies that reduce antibody levels in patients with fibromyalgia are more likely to work than other therapies. This is even more positive because it's essentially an autoimmune condition, and we already have treatments out there for other autoimmune conditions. At the moment, fibromyalgia is very, very tricky, and it's one of the most difficult conditions to treat. And also, even in the medical community, there's disagreements about what we should do. So generally there's medications, there's physical therapy, there's counselling, but this can have very, very limited success. Like I mentioned, this is a very, very early study, and there are still some next steps to do. But this is a massive step forward in something that's very difficult to treat, and sometimes we as doctors don't know what to do when we see patients because they've tried everything. I think the next steps in this study are going to be to see what factors the antibodies bind to. This will be able to give specific treatment for fibromyalgia, but also testing. It will help us design a blood test to be able to diagnose fibromyalgia. So yeah, it's something I'll be keeping a very, very close eye on.